for the next talk that we have, and that's by Nishikant Borse, who won the CS Reshmi in 2018. And Nishikant is Senior Vitreoretina Consultant at Insight Eye Clinic in Mumbai. And a phenomenal surgeon, a wonderful friend. Nishikant, all over to you.
Thank you very much, Dr. Partha. I'll just try to share my screen. Oops. I hope my screen is visible.
Yes, yes, please.
Okay, so I would like to just discuss my journey to CS Reshmi Award, and I'm thankful to AIOC and Dr. Partha for giving me this opportunity. So, 1 minute. Why isn't it going ahead? I'm sorry, it's not
Click on
going
the presentation.
forward.
And then
Yeah, it is. Yeah. Okay, so the beginning is always a concept, and I had a concept that why can't we manage CRO surgically? And if it is to be managed surgically, how and what are the merits? And it really took me 8 years to bring it up to the level that I could present it. Now, why did I choose it as a video is because the best way to demonstrate a surgical concept is the video of the surgery itself. And my video actually I made because I was so passionate about it. I wanted to demonstrate the concept that you can surgically manage a CRO. Actually, it was not made to win awards. Now, my work with CRO started when I found that the 4 consecutive cases that I got of CRO, I could not manage them well. We lost the vision in that eye despite best of my efforts. I looked up the literature, it really didn't help. And I always saw that the minute you induce a hypotony, the circulation does come back, but once the IOP grows back, the CRO sets in again. Then I was constantly thinking of ways in which I could prolong the hypotony, and then I thought whether a vitrectomy would work. And then came my first case. There was a case who had a CRO, and she had a funny sort of a glial tissue on top of the optic disc, and I thought maybe that is the reason for that. And this was my first case in which I went ahead and I did a vitrectomy and I removed the glial band. And after I removed the glial band, I decided to just massage the artery a bit. And to my surprise, what I found that the perfusion had got restored and this patient really recovered well. Now you can imagine, this is a video of a very about 11 years old. So it's not a very good video quality, but then I realized that if I have to present it, I really need to upgrade into a better video. Then over a period of time, I started evolving my surgery. I spoke to Dr. Gopal from Shankar Netrala and he said, don't just jump into it. Let the surgery evolve and you will realize what is the correct thing to do. I started observing that the glial tissue is very uncommon, the one that I saw in the first case, but the most common was no PVD in each of the cases of CRA I saw. And then I evolved it into a surgery where there is a hypotony, you do a disc massage, dissection, you do an arterial schistotomy, massage, and you even have to nick the CRA if you find a presence of an embolus, which is directly on that. And this is how I began my journey to the video. Now, every person who tries to sell a concept or give a concept should be ready for failures or rejection. My first attempt, I sent it to AO straight off because I was so overexcited and got totally rejected. Then I went and presented it at the Floor Retina. It was not well accepted, but our local retina colleagues were really helpful and they gave me a lot of encouragement and it was very well received. And then I started understanding that to sell a concept, your video has to be made into a beautiful bouquet. The bouquet does not have to be fancy, but it has to have a particular story. You have to have a good storyline, which should be short and a precise story. It should have an introduction, a main body, and a conclusion, and build a gradual storyline with a good flow, which is not abrupt. Of course, because you're presenting a surgical video, your good video quality has to be fantastic. And you should write the dialogues for each part of the video and time it well exactly when it is happening with the video. Don't be afraid to use another person's voice if your voice is not suited. I felt my voice was not good, so I used my wife's voice. And I recorded in the middle of the night to get silence in Mumbai. So at 2 o'clock in the night, we recorded this particular video. Please give emphasis on audio. They should complement your commentary and not they bury each other. You select a royalty-free music to avoid legal issues. The spoken audio should match with your theme music, and the theme should have a crescendo and a diminuendo. It should not be abrupt. The last thing is the points to remember is you can easily make your own videos on software like iMovie, Wondershare, Filmora, etc. But don't be afraid to take professional areas where you want to highlight your concept and your video is not going well. Learn the software well before you start editing. Good editing is the key for a successful video. And you can adjust the speed of the video, contrast, etc. very easily. And please crop off unnecessary field, especially in VR. We get people who have a big screen and a very small area where the surgery is happening. So learn to crop it off so that you get a perfect thing. Lastly, the common lethal mistake is either too long or very too short a video. Using scenes from movies which are having a totally disconnect. They use a very longer clip from movie that gives rise to copyright issues. Displaying the patient's identity in clinical photographs. I was one of the judge for the last time CS RESHMI, so I noticed these were the errors that people made. Either your audio can be too loud or too soft, which you can't hear. So you have to just take care of all these things to get in your point of your video. And please don't give a very long introduction or statistics which take away their attention from the main concept. Having said that, let me just give the preview, a short preview of my movie.
I think the audio is missing. Audio is not there.
Can
1
you hear
minute
it?
remaining.
Your audio is not coming.
No, we can't hear it.
The audio
You
is
have
not.
to stop sharing and then you have to share sound also in Zoom.
Is my video audio not visible?
Audio is
Was
not.
it not audible?
Video can be seen.
The audio
Can I
was not
request
visible.
it?
No, Nishikant, you stop sharing first.
Yes,
Then
stop sharing first, then share again. Share your video with
again,
share
and then
sound.
go to the left side. There will be a button.
Okay.
Then you enable that.
Okay, I will stop sharing first, and
Then you click on this share screen, and on the
okay,
left side
I'll
you
do
will
that.
see a audio button, and वहाँ पे enable करना. Could you see on the left side?
Yeah, I'm just trying it, sir. Sorry about that. Just give me a minute. Okay. Can you hear it now?
No, Nishikant.
No audio.
Anand, can you play it from the back end? Anand?
Don't have the copy, sir.
Okay.
Is it audible?
No, audible.
The audio is not there.
Video is
The video we can see.
Can you-
This could be
can we
because the audio would be going to the other channel. You will have to do a little bit of juggling in that. You're using a Mac. On the top right, you will see the speaker. Click on the speaker
Okay.
and see where it is playing output. What is the
Okay,
output?
I'll make it
Yeah, click
internal.
on that.
I
If you
think
can
it's
click on
okay.
the
We
speaker
can just see
icon.
the video also. It's all right.
Okay, can you now? I think it will come.
No luck. No luck.
Oh, I'm so sorry. I really don't know why.
But that's all right.
Can
I
we?
think
I'll
it
send
went.
the video. Can we present it from there?
Let's see the video of Partha.
Yeah, sir.
Or can
Nishikant,
we
let us-
play it from? I had sent it to Dr. Mr. Sethi yesterday.
Just a second, sir.
Okay. So in between, can I request Dr. Maipal sir and Parikshit to start the discussion, and once Anand is ready, we can see the video.
Without seeing the video.
I
Well,
think-
we have seen the.
There were very important points, I think, which Dr. Nishikant mentioned. Some of the points were very good.
Maipal sir?
Okay. First of all, I'll wish to thank Dr. Nishikant for bringing out some fantastic points, and I think carrying on from where Rohit left, it is very, very important not to give a garbled message, in the sense that if you want, at times people want to put too much into a small little thing, the take home message gets lost. And that is exactly what Dr. Borse is trying to make out, that maybe we want to put, because it's a video competition, and the statistics, etc., like he's saying, need not take a major part. That should be in the publication where you can give statistics, etc. And the other important things that he has made out is the field of view, which is very, very important. If you don't have a proper magnification, like in life sciences center, etc. So similarly, when you are making a particular video, the contrast should be good, the illumination should be good, and the point of focus should actually be highlighted, and that is something very, very important. Otherwise, you just keep meandering around here and there, and everything is there, the message actually gets lost. So what he has tried to actually tell is that you need to keep a focus, and in the focus he has said, keep the focus on the preparation, keep the focus on maybe even using software, etc. But you need to master whatever you are going to use for the video, the editing, the superscript, or whatever you want to do. And also he has given very important points as regards the audio, as that it should not be too loud. At times people want to bring in movies, etc., as he's saying, which may or may not add any value to the whole thing. So scientific content with a clear-cut message, with the proper focus on what you are trying to show and what you are going to pass on as the take-home message. I think that is something very, very great that he has pointed out. Simple points, but as he said also as a judge, that you should not show the photograph of a patient, etc. You should maintain the secrecy, because these can land people in trouble subsequently. So that is again something very important, that you need to follow the because nowadays when you are writing a paper, you have to say that it has been approved by the ethics committee, etc. I think so similar kind of ethics need also to be followed for making the video presentations. Overall, I think he has given a fantastic take-home presentation for the people who are aspiring to make great videos. And as they say, a picture or a video says much more than what you are writing in a text. So that is something very, very important, that it hits you right in the face, like in the posterior polar cataract is shown, and similarly, like he's talking about CRAO, the message is very clear that this is a methodology where you need a reduction in the intraocular pressure on a long-term basis, and if there is, say, a gliosis, etc., that needs to be moved. So thank you very much, Dr. Borse, for sharing these details with the people who are listening.
Thank you, Maipal, sir. You said it all. If I may just add a point, Dr. Borse is, of course, our senior from Nashik and Maharashtra. And one thing is that all the three presenters which have shown so far, they had a small storyline for their small movie or a video, and they stuck to it, and it was neither too long or too short, as Dr. Borse said. And again, Dr. Nishikant now is in his own practice, so you don't have to be particularly a big institution person to make a video. I think that's the message that he has given. Thank you, sir. Thank you for giving.
Thank you very much, Parikshit. Parikshit, we were all taken by the newness of the concept. Nishikant's video had that fantastic concept which he was trying to drive in, which is so difficult at times. And as he very correctly said, the international faculty or the judges were not at all happy with it, and he did not win prizes. But it was in India that people thought, yes, this is a concept. But again, Nishikant, this is something that goes into publication, does it not?
Yes, I mean,
Sir,
you
it's
have
already
to have
been
a longer
accepted,
series.
and it's going to be published within a month. So I'm happy
Wow.
to share that.
Wow.
So I wanted to highlight, actually, unfortunately, the audio didn't come in, but another important point of the audio, which you have worked very hard on this video, is the crescendo and how, it should go down towards the end of the story. And many a times people end the audio abruptly, and that actually takes away the fun of watching the movie. So that is something else that people have to get into. Audio is very important, and you have to really, the emotions go with audio. That's what I would say.
Quite true.